and welcome. You're listening to the Sickle Cell Action Network, a weekly internet radio show presented by Martin Center Sickle Cell Initiative and sponsored by Mass Therapeutics. We are coming to you live from Indianapolis, Indiana, and we're here to serve you by providing up-to-date information and opinion on all matters pertaining to sickle cell disease. My name is Gary A. Gibson, and I am your host for the next 2 hours. Let me start by saying that I don't have sickle cell disease, nor do I carry the sickle cell trait. In spite of that, I am no stranger to sickle cell. Quite the contrary. You see, even though I don't have sickle cell, it has had a very huge impact on my life. That's true because its complications took my wife from me after 12 years of marriage. It also caused her to have a miscarriage that resulted in the loss of our twin babies that she was carrying while in a sickle cell crisis. So all told, sickle cell has taken 3 lives from me, and I feel the pain of those losses every single day. I currently serve as the president and CEO of Martin Center Sickle Cell Initiative, a community-based organization that has been serving people with sickle cell for over 45 years. Each day I attempt to transform the pain of my losses into energy that is focused on making a difference for those who are battling sickle cell. From being involved with sickle cell for over 40 years, I'm able to say that much progress has been made, but there is still so much work to do. This show is an opportunity to contribute to the ever-expanding dialogue about sickle cell that is taking place all around the world. Our show is about raising awareness, but it is also about so much more. I like to say that sickle cell awareness is important, but we need more than awareness. Those living with sickle cell are already aware. That makes me ask, so what are we doing for them? My answer is, not enough. That's why we've named this show the Sickle Cell Action Network, because awareness without action has very little impact. We want this show to be a source of information and a call to action to help those who must live with sickle cell in their midst. We have designed the show to provide information that is beneficial to patients, caregivers, family members, and friends alike. Most importantly, we want people with sickle cell to know and understand that they are not alone. The Sickle Cell Action Network show features live guests who are healthcare providers, patients, advocates, and others who are engaged in the fight to eradicate sickle cell and ease its burden on those it affects. Today, we are honored to have 2 special guests to speak to us about parenting and sickle cell. Joining me in studio today are Mary Moore, a registered nurse who has a child with sickle cell, and soon to arrive, I hope, is Valerie Snow, the mother of a young man with sickle cell. We're going to be happy to have both of them with us here today. Before we get to today's topic, however, I want to share some of our upcoming topics with you so that you'll know what we're going to be up to. In future weeks, we will cover such topics as sickle cell service agencies, that's next week, sickle cell research update, traveling with sickle cell, connecting the sickle cell community, and many, many others. So as you can see, we are serious about sharing valuable information, and we hope that you will join us every week, same time, same station. If you've missed some of our previous editions or wish that you could listen to them again, don't worry. Just go to the Martin Center Sickle Cell Initiative YouTube page and you'll find them there. Now let's get on with our show, and we'll start with this week's edition of Sickle Cell News Update. And for today's Sickle Cell News Update, we have a few stories that we'd like to share with you. And the first story comes to us, and this story is coming to us from Uganda, and its title is Experts Call for Sickle Cell Screening in Newborns. The CPHL has capacity to test between 500 and 1,000 samples a day, it says. A laboratory assistant observing the samples before approval at the Central Health Public Laboratories that's what the CPHL stands for, Central Health Public Laboratories. At the Central Health Public Laboratories, experts have called for nationwide screening of the sickle cell condition in newborns. Charles Kiyaga, a biomedical scientist and national coordinator for the Early Infant Diagnosis Program at the CPHL, said over 25,000 babies are born with sickle cell in Uganda every year. But by 5 years, 80 to 90% of these newborns have died, classifying the condition as one of the highest contributors of the 68,000 children who die in the country before their 5th birthday. What is ideal is that every newborn is screened for this condition so that parents and health workers can know how to manage them in case they have the condition, the EID National Coordinator said during a media tour of the facility on Buganda Road in Kampala. Many parents suffer with babies who have this condition, but they don't even know that it is this condition that's affecting their babies. Kids are sickly now and then until they die. But if they were screened and confirmed positive for the condition, they can be helped to live. The CPHL has capacity to test between 500 and 1,000 samples a day. The challenge is the expensive reagents used to screen this genetic condition. A single test, including sample collection, is not cheap, they say. So if we were to carry out tests for all the 1.6 million babies who are born in the country annually, we would need a lot of money, the EID National Coordinator said. Currently, we are screening for sickle cell in newborns in 8 districts from mainly north and eastern Uganda, which have the highest sickle cell prevalence. But it is a question of funding, he said. So that is coming to us from Uganda. Interestingly enough, there is a story about sickle cell in the Washington Post, and this was posted just yesterday, and the article focuses on a person named Janoi Burgess who has sickle cell disease, and he says, I used to love going to the hospital and the doctors because they had a section where you could play games, and he says they were really nice and friendly. But when he turned 21, the South Florida resident could no longer go to his pediatric specialist. Instead, he bounced around to various primary care doctors for adults, none of whom seemed well versed in the details of his condition. When he had a painful sickle cell crisis 2 years later, his only choice was to go to a hospital emergency department where he says he waited 3 hours for pain medication. They triage you based on severity, and pain is not something that they consider as severe as other conditions, he recently recalled. One doctor even said, your labs are okay, so you're not in pain. It was crazy and insulting at the same time, he said. Burgess's experience is not unusual among many adults with sickle cell Burgess's experience is not unusual among many adults with sickle cell that affects approximately 100,000 people in the United States, most of them African Americans. For many years, most people with sickle cell died in childhood or adolescence, and the condition remained in the province of pediatrics. During the past 2 decades, advances in routine care have allowed many people to live into middle age and beyond. Some people with sickle cell disease are actually living to be elderly, and the majority of patients are adults, said Wally Smith, a professor of internal medicine at the Virginia Commonwealth University Medical Center. We don't have a health care system ready for that. Early adulthood, a time when parents make a switch from pediatric to adult care, can be perilous for these patients. A 2010 study of 940 Dallas people with sickle cell who were born after 1982 reported that the period immediately after they aged out of pediatric care was the riskiest for death. And the article goes on, and it is great to see a really long article about sickle cell in one of the nation's top newspapers, the Washington Post. And it ends by saying that Burgess, now 28, finally found an adult specialist who stabilized his sickle cell, enabling him to complete a college nursing degree. There are a few nurses who made an impact on my life, and I'd like to add to that, he said. I have a need to help, and I feel like I can do it. So thank you to the Washington Post for giving some exposure to sickle cell disease. Our last story today is coming to us from the University of Rochester, and this story is how the University of Rochester is going to open a new center called a Complex Care Center, and the Complex Care Center will be Rochester's first primary care practice dedicated to caring for adults with chronic childhood onset conditions such as cystic fibrosis, sickle cell anemia, childhood cancers, autism, and intellectual and developmental disabilities. A primary care practice devoted to adults with sickle cell disease is not only new in Rochester. Across the nation, only a few such centers exist. But demand for this type of care is rising as the patient population grows. Thanks to medical advances, more than 90% of children with special health care needs now reach adulthood. And for some conditions, adult patients outnumber children. The center will offer specialized outpatient services to better meet the needs of patients who often have multiple severe conditions that require close management and who face disparities in accessing health care. Patients who graduate from pediatric-focused care often have a combination of challenges moving to an adult primary care setting. They may have difficulty finding a provider, and lack of reliable access to outpatient care often results in preventable emergency department visits and hospital stays. And this is another long article, and it ends by saying that, let me get to that. The Complex Care Center team will also explore new approaches to caring for patients with complex needs. Only a generation ago, patients with conditions like sickle cell disease or cystic fibrosis did not survive to adulthood. So medical providers haven't formed consensus on the best approaches to care for adult patients. Resources for providers and patients are in short supply. The center aims to be a resource for primary care providers in Rochester and the region who also see patients with complex conditions by offering them information and support, including phone consultations, educational sessions, and patient care protocols designed for them. A Greater Rochester Health Foundation grant supports the center's workforce development initiatives. Congratulations to the University of Rochester for developing and implementing this new complex care center, which will be, I hope, a model for other centers to develop and start operating around the United States. So that is it for Sickle Cell News Update today. We're going to take a break, and when we come back, we will start our discussion about parenting and sickle cell. This is the Sickle Cell Action Network, and I am your host, Gary A. Gibson, and we'll be back.
Fast Therapeutics is leading the way in developing treatments for sickle cell disease. We're proud to sponsor the Martin Center Sickle Cell Initiative in its mission to provide leadership, education, and support services to the sickle cell community. Fast Therapeutics is leading the way in developing treatments for sickle cell disease. We're proud to sponsor the Martin Center Sickle Cell Initiative in its mission to provide leadership, education, and support services to the sickle cell community.
Welcome back to the Sickle Cell Action Network. I'm your host, Gary A. Gibson, and it is Tuesday, March 22nd. I don't know what the weather is like where you are, but here in Indianapolis we have a beautiful spring day. A little on the cooler side, a little breezy, but the sun is shining, and anytime the sun is shining, I think everybody feels a little bit better. With me today is Mary Moore, and Mary Moore is a really special person because she is not only the parent of a beautiful little girl that has sickle cell disease, she is also a registered nurse. So most of Mary's life is about caregiving, and I have one of the highest levels of appreciation, I guess is the word. The highest levels of appreciation for people that are caregivers. So, Mary, welcome to the Sickle Cell Action Network.
Thank you.
And I'm glad that you're here with us. And on behalf of those that you take care of, let me thank you for doing what you do as a caregiver.
Thank you very much, Gary.
So, we always ask our guests to tell us a little bit about themselves so that they get a chance to get a sense for who they're listening to. So I'll ask you a couple questions and you can answer them. The first question is, where are you from originally?
I'm originally from Champaign, Illinois.
I didn't know that. Okay.
Born and raised there.
And so you are a registered nurse, right?
Yes, sir.
And so tell me, where did you obtain your medical training?
Well, I started off in Illinois as a CNA and worked up the ladder as a licensed practical nurse and moved here to Indianapolis in 2005 and waited a few years and decided to go back to get my registered nurse license at ITT Tech.
Okay. So some people don't understand all of these acronyms when you're talking about, CNA, RN, LPN. Just go over that for us just a little bit. What's the difference between them?
Well, a CNA is a certified nursing assistant and basically certified in taking care of individuals with their daily living, as far as bathing, cleaning the house or cleaning the hospital room or their room in the nursing home, just their basic necessities, maybe feeding, included in that, and just assisting the nurse, and maybe a licensed practical nurse or a registered nurse.
Okay.
And
so CNA is kind of the starter entry point.
Yes, and some individuals take that route. I took it basically to see whether the medical field was my niche, and decided on early as working as a CNA in the hospital that I definitely wanted to go further and obtain my nursing license.
Okay. And so you go from CNA to LPN.
Yes.
And LPN is licensed practical nurse.
Yes.
Okay.
So as working as a licensed practical nurse, I worked at several different places, mainly in the nursing home. And basically you're kind of a go-all type person. You assist the CNAs, you pass pills to the residents, you may help feed, you may help individuals do just a number of things. You're working with the families, and also administration as well.
Okay. And
you're practically working underneath the registered nurse.
Okay. And then the registered nurse is?
The registered nurse is basically the manager, and in that type of facility, if it's a nursing home or either hospital setting. Registered nurse have pretty much all of the responsibilities on them. The go-all person. They help with care planning with the families and the patients. They deliver medications. They do treatments. Treatment as far as like if a person have open areas or anything like that.
Mm-hmm.
Infusions. Just whatever you can think of, shots and all of that stuff.
Okay. So do LPNs, are they not able to dispense medicine or not?
Yes, they are able to dispense medications, as well as the registered nurse. And the registered nurse is pretty much the license carrier, and a lot of times the licensed practical nurse has to get authorization from the registered nurse to do certain things.
Gotcha. Okay. Just try to be sure everybody understands things, because a lot of us see these things and they're not always explained.
Yes.
Right. So tell us about your daughter a little bit, Mary. How old was she when she was diagnosed? Well, first of all, how old is she now?
She's 6 years old.
She's 6, and how old was she when she was diagnosed with sickle cell?
Miriam was just an infant. During the newborn screenings at the hospitals now, they started doing newborn screenings, I believe, between 10,
It was
15
1985
years ago.
in Indiana,
Okay.
and about the same time in Illinois.
Okay.
Mm-hmm.
So they are able to detect any type of genetic factors with newborns during that time. So she was approximately 7 days old when I got a call from her pediatrician stating that she had the disease.
Okay. Did you have, any reason to suspect that she might beforehand?
No, I did not.
Okay.
I knew that I had the sickle cell trait, and which was kind of funny. In Illinois, I learned that with my second son. I have 3 children, and my second son, which is 11 years younger than my oldest, I found out then that I had the trait, the C trait.
Okay.
And then when I got pregnant with Miriam here, they asked me about that, and of course they do a series of testing with mothers who are pregnant,
Mm-hmm.
and they tested me for the sickle cell trait, and they stated that I did not have the trait.
Okay. So when you found out that Miriam had tested positive for sickle cell, what were your first reactions?
I was in denial. I was shocked. I asked her pediatrician if they could retest, because things have a tendency to get misdiagnosed at times, and really went through a state of depression.
And that is normal. Did you have any idea of what it meant when you got the call? I mean, obviously you must have, if it was going to cause you to have a feeling of denial and things like that, you must have had a clue about what was in store.
Yes, I only had a little information on sickle cell, and one of the main things that I did know about it is it was primarily a death sentence. When I was in school, I know that there were a couple individuals that had the disease and ended up dying early. So as a result, when they told me about my daughter having the disease, that's the first thing that I thought about, was that she was going to die early.
Okay, and then as you started to accept the news, and how did you work through that, Mary? And this is important for you to share this, because there are people out there now in the same boat right now.
Basically, when I started to accept her disease, I started to get more education on it, and thanks to the Indiana Thrombosis and also the Martin Center, the representatives, Gary Gibson, and also the staff at Martin Center, and then Indiana Thrombosis with Keisha Braswell, I was able to get the information that I needed as far as what the disease was, how did she get it, and how we're going to proceed further with caring for her and making sure that she gets the proper treatment. I started to research more on the disease myself, started to get more involved, started to become an advocate and talking to other individuals with the disease, and I started to get a little bit more comfortable with there is hope, and what my hematologist for Miriam told me was, in her lifetime, with the advancement of technology and medicine, it may eventually be a cure.
Absolutely. Thank you for sharing that, and it's personal, and we always appreciate the fact that we ask some tough questions, but you realize they're to help others, for others to hear. It can be something that you can accept and learn to live with. And in fact, I think, Mary, as we go on, some of the things that I think you're going to say in answer to my questions are going to prove what I already know about you. Is being proactive is a big part of this, taking control. And I appreciate what you've done. I appreciate the fact that you are also advocating as you are, and we'll probably touch on a little bit of that a little bit later. So initially, maybe you started doing your research, but would you say that you felt well prepared for taking care of Miriam during the early stages of her life, or not?
Well, it kind of, it goes both ways. I am a nurse, and I'm used to taking care of other individuals, but working on the other side of the fence,
right,
that was a challenge, because I had to basically surrender to those who were more of an expert.
I'm going to ask you about that.
Yes. So I had the foundation of taking care of individuals, but I work with geriatrics, not pediatrics, and I am a mother. And
you got the whole spectrum covered, don't you?
Yes. So as a result, I was able to basically just kind of like surrender. I like to have control, so I had to surrender that control.
Right, and that is not easy to do, right?
Not easy to do. I had to learn the hard way, and also I was always the caregiver and always the giver to other individuals that was less fortunate, and in this time period with having a sick child, I had to pretty much accept things that were given to me without feeling the guilt.
Well, since you went there, let's go into that a little bit too, because that's also important. Did you struggle with guilt?
I did.
Okay. And tell us about that. What did you feel? What kind of guilt did you feel?
Well, there were several different types of guilt that I felt. The first basically was I felt guilty regarding Miriam having the disease. I felt as if it was my fault, and that by her being a baby and not having to ask for this, I felt as if it was my fault. And I had to learn the hard way that sometimes in life you have to go through things to better help or educate or other individuals. And so I went through that process of feeling guilty for basically birthing her into this world with a chronic disease of sickle cell.
And how long would you say that you had to struggle through that guilt? Work your way out of it? Actually,
it was a few years. I think probably for the first 3 to 4 years, and sometimes I have setbacks, whenever she's sick.
Sure. And
she's wondering why she's sick, even though she knows she has sickle cell, and she'll tell you that she has sickle cell, but a child thinks as a child, she doesn't really know why. So sometimes I feel bad that, she's sick and not really knowing the actual reason why.
Mary, thank you for bringing that up. I mean, that is really, really important that you did. And one of the reasons I say that is because guilt is a big part of the situation when it comes to families with sickle cell. And a lot of people just kind of hide from it, don't acknowledge it, don't live up to it. Thank you for being so honest with us. We're going to take a break, and when we come back, we're going to continue our discussion about parenting and sickle cell. Thank you for listening to the Sickle Cell Action Network. I'm Gary A. Gibson, your host, and with me is Mary Moore. And Mary is a registered nurse with a 6-year-old daughter who has sickle cell disease. And Mary is constantly caregiving, and she's a great guest for us today. Mary, let's pick up where we left off. And one of the things that we talk a lot about when it comes to sickle cell is the medical complications that it brings. In fact, that is one of the biggest problems of sickle cell, is that it can cause so many different kinds of medical complications. Has Miriam experienced any medical complications that you can think of that have been major events? For instance, a lot of kids have strokes. A lot of kids have their spleens removed, things like that. What has Miriam experienced any of those things?
No, Gary. Miriam has not.
Great.
And we keep our fingers crossed that she will not. But there is a big possibility that she could. And that's several of the things that I was educated on with Miriam when I found out that she had sickle cell. During her first 3 years of life, Miriam was in and out of the hospital quite frequently, probably like every month it seemed like, and she had just infections of the blood. She had RSV. She had just a number of things that typically with a normal child it would just be a doctor visit and home, but since she had sickle cell,
right,
they wanted to do a little bit more aggressive treatment with her to make sure that her infections or whatever didn't go into a full-blown crisis or any other infections that will affect the spleen or anything like that.
So again, because you've done your homework, you're aware that a lot of these kinds of things could happen. And first of all, one of the best ways to be able to respond to something is to be prepared in advance. Whether you're talking about, a tornado warning or anything like that, that's the purpose of a tornado warning, to let you know to get ready just in case. And so, as it relates to sickle cell, knowledge about the kinds of things that can happen is the first step of preparedness. Do you agree with that?
I would definitely agree with that. And since I am in tune with noticing signs and symptoms of different things, I'm really proactive when it comes down to her health. I'm basically her doctor at home.
Exactly, and I was going to ask you about that. I think, how do you deal with that? I mean, are you a little extra cautious, would you say, so that anytime you see something with her, maybe you start wondering whether or not it's going to be a problem?
Well, Gary, I used to really hover over her and really didn't want her to do a whole lot of stuff, and I came to a conclusion to just try to make sure that she enjoy her childhood as much as possible. However, I am very proactive with her. I make sure that she gets plenty of hydration, basically Gatorade or water. Try to push that as much as possible, even though she don't really like to drink it. But we pretty much like to flavor her water, and she'll drink more of that. And then also just giving her folic acid that she takes every day. But for the first 5 years, she was on penicillin prophylactically twice a day, and basically that was to help decrease the number of infections that she possibly could have. And let me reiterate, Miriam has the sickle cell SC disease, which is typically a lesser form or a milder form of the sickle cell disease.
Right, I was going to ask about that.
Other than the SS. However, there are SC individuals that have just as much or as
more
many complications as beta thalassemia or the sickle cell SS disease. There are just so many types of diseases that I had to learn myself, and I was quite interested in learning, just the different types and what all the complication causes and so on and so forth.
So you've said a couple things I want to circle back on. One was the penicillin prophylaxis, which is something that doctors recommend starting from birth and pretty much all the way up until the age of 5. And so I'm very happy to hear that was a regimen that you followed, and that's something that we encourage everybody to do with young children. And it is one of the leading causes of death in parts of the world where this type of medication is not readily available. So in places like Africa and Nigeria and Uganda that we just mentioned earlier on, places like that don't have access to those penicillin medications, that's where they have the higher rates of death, and the higher rates of death come from the fact that infections go out of control. And penicillin proactively or prophylactically is something that helps minimize that. So I'm glad to hear that. Secondly, I remember we had on the show Dr. Emily Meyer from the Indiana Hemophilia and Thrombosis Center a while back, and she talked about that, penicillin prophylactic treatment as well. So anyway, thanks for bringing that up. That's good information too. But in our discussion with Dr. Meyer, and actually a few of the other doctors that we've had on the show, whether it's Dr. Mehta and others, is that one of the difficulties with sickle cell is that it can vary so much from patient to patient. And I like to say that I can bring 7 people into a room and put them around the table. Each of them has sickle cell SS or sickle cell SC, whatever, it doesn't matter, and all 7 of them will be able to tell you an entirely different story about what it's done to them or how it's treated them and the things that they've had to deal with. And you are absolutely right that some people with sickle cell SC actually can seem to have more problems than some people with sickle cell SS, even though that is not the rule, that's not the norm, but it can happen, and same is true with sickle cell beta thalassemia. So you're bringing up some really good informational points, and I thank you for that. So let me take you down a little bit of a different path here. For doctors, getting information from parents is critical when it comes to treating children with any illness. But because of its nature, it may be even more important when the child has sickle cell. So would you please explain how you go about informing the doctors about Miriam's condition, particularly when you have more of an urgent situation going on? How do you talk to the doctors?
I'll basically talk to the doctors, informing them regarding Miriam's signs and symptoms. Has she had a fever? What is she complaining of? Has she been lethargic, sleepy, tired? Has she been eating? Has she been urinating okay? And I guess, with being a nurse, I can, pretty much zero in on a lot of the things that they will ask for, to zero in on what is really going on with her at that time. Had it been a seasonal change? Has it been stress in her life? Has it been a weather change? It could be a number of things that could trigger symptoms with her that could eventually go into a crisis. But like I stated before, I like to be more proactive. So once the doctor is asking me questions about her, I like to be as thorough as possible. I like to put a mental note in, when this or whenever she started experiencing these symptoms or whatever, so we can pretty much zero in on what we need to do and how we need to do it and get the problem rectified as soon as possible.
I think you have an advantage that maybe a lot of other folks don't, because you can speak a little doctor speak, right?
Yes.
Yeah, and everybody can't do that.
Right.
And so I think when you're talking to them, that actually might make it a little better for you and Miriam than it might for others, because you can just go right into that, what I call doctor speak, and get right to it. So thanks for sharing that answer. So what has Miriam's history with crises been like?
Miriam had one crisis that was pretty severe when she was 24 months. Before then and after that, she's just been basically having a lot of infections and colds and fevers that we've been pretty much tapering in on before it actually goes into a crisis. But the very first time that she had a crisis that I can remember was when she was 24 months. And I will reiterate this, is that you can be taught and educated on everything that you need to know about what to do when your child experiences her or his crises, but when it actually happens to you in the middle of the night, you're kind of lost, you're stuck. And trying to get your composure and to think about what you need to do to rectify or resolve the problem as much as possible. And as a parent, a mother, the first thing we want to do is to console our child whenever they're in pain or whatever. And that's something that they don't want you to do, is touch them when they are in pain all over.
Right. I can definitely relate to that, Mary. As I mentioned, I spent 12 years as a spouse of a person with sickle cell disease, and the very first experience that I had with the crisis, I can relate exactly to what you said. You think you're ready, and then boom, it hits you. And I did try to touch her, and I'll never forget how loud she screamed when I touched her, and it scared the hell out of me, to be honest with you. It's like, what did I do? Don't touch me, she yelled. I'll never forget that, and I'll never forget the look on her face when she said it. So I understand that. I think, what do you do now? I mean, so you've had that first experience, but now, and you're saying that Miriam doesn't have that many crises, and understand that, but do you feel like the next time it'll be a little easier on you? And that's important too, because I think we care a tremendous amount about the patients that have sickle cell, but I personally also care a tremendous amount about the people that take care of people that have sickle cell. So I care on both ends. But I think my question is, how do you keep yourself in check as the caregiver? Because I'll tell you, one of the hardest things that I had to deal with as a caregiver was a feeling of helplessness. Mm-hmm. In that, okay, I can take you to the hospital, I can get you to the doctor, I can go get your meds, I can do all of these things, but I cannot take your pain away. And I really want to. You ever experienced that emotion?
Oh, yes, I can really relate to the helplessness area of that. And even now, when the school calls me, my heart just kind of dropped, because I'm not for sure what is going to be said on the other line.
Right.
So I just pray when I answer the phone that it's just something simple as Miriam just wants some attention. So basically, feeling of helplessness is basically where I'm at, and you can never prepare yourself for the unknown. And even though anything can happen to any one of us, I know for sure that something can definitely happen to Miriam.
Right.
And for me to really just give up the control and let someone else take care of her, like she's in school, and I feel comfortable enough of letting them take care of her and make sure that she's doing okay. That was a big challenge for me as well. Far as feeling that I can't do anything about her pain, because she does have pain at times, and she's wanting to know why she's having this pain. And normally we could get it rectified with just Tylenol or ibuprofen, but she does have some big guns on hand, which is the hydrocodone, mm-hmm. if she needs that. Mm-hmm. And she also has that at school as well. Mm-hmm. And they would typically call me before they give it to her, mm-hmm. that she's having this pain or whatever, and so on and so forth. And they are pretty much educated on what to do, how to do it. And then if it's anything that has that she has to go through, that the medicines will not work, then they know to call me, and I will be there.
Okay.
As expeditiously as possible.
How would you say it has been in terms of working with the school to be sure that they know how to help her when they need to help her, or when to call you? Has it been easy to make these arrangements with the school?
Yes, I had Keisha, the Sickle Safe coordinator, go out and do an informational piece with the school, the teachers and bus drivers and the nursing staff. However, of course, it's always individuals, if they don't work with the person, or if she doesn't have as many symptoms every day, they have a tendency to kind of forget a little bit. So sometimes I have to give them a sickle cell 101 on the phone, just to make sure that I'm comfortable with you knowing what to do.
Right. And that's important. You've got to feel comfortable.
So it's just basically following up and making sure that everybody is still on the same page. And that goes for anything. You just pretty much have to keep them abreast of what's going on. And it was an issue with Miriam at school, and she was having some headaches, and they were like, well, we don't know why she's having these headaches and what should we do. And I had to pretty much re-educate them about that and make sure that they give her some rest and fluids, water or Gatorade or whatever, and her medications there. So typically it would usually work, but like I said, sometimes they need the extra piece of following up.
Right, and so in other words, it takes a little bit of work.
Yes.
But it's about being proactive again.
Yes.
And that's the message that we want people listening to get. Take control. Take control. We are going to take a break, and when we come back, we are going to continue our discussion about parenting with sickle cell, and we are hopeful that you'll stay with us, myself and Mary Moore. This is the Sickle Cell Action Network Internet Radio Show on RadioNext.tv, the Cool Groove site.
Mass Therapeutics is leading the way in developing treatments for sickle cell disease. We're proud to sponsor the Martin Center Sickle Cell Initiative in its mission to provide leadership, education, and support services to the sickle cell community.
Hi, I'm Gary A. Gibson, your host for the Sickle Cell Action Network Internet Radio Show. If you are impacted by sickle cell disease in any way, whether you are a patient, a caregiver, or a friend, you need to join me every Tuesday at 4 p.m. Eastern Time. I promise that you will find our show to be full of information, perspective, and opinion about all things sickle cell. See you Tuesday right here on RadioNext.tv, the Cool Groove site. Welcome back to the Sickle Cell Action Network. I'm Gary A. Gibson, your host, and I am sitting with Mary Moore, a registered nurse and mother of a 6-year-old daughter with sickle cell. And Mary is being so kind as to share her thoughts and her soul, actually, with us. And thank you, Mary. Let's ask you about one of the things that is a big part of living with sickle cell is trips to the hospital. And sometimes I've talked with people that tell me they do everything absolutely in their power to have to avoid going to the hospital because they hate that experience so much. But sometimes it becomes really the only option left. So what kind of processes do you go through in determining whether or not it's time to take Miriam to the hospital?
Yes, Gary, I am with those individuals that try to
avoid it.
To avoid it at all costs. I do not like the hospitals. However, Miriam absolutely loves it.
Yeah.
They treat her very, very well and spoil her. And it's not like she's not already spoiled, but she likes to get that extra attention from strangers. Basically, with Miriam, she would want to go to the hospital anytime she feels sick or ill or whatever, but I have been dealing with this with her for 6 years now, and so I know exactly when to take her in. If Miriam has had a fever for like 24 hours that I just cannot get down to normal limits, she may range between 103, 104, and if she just continuously cannot kick that fever without the home remedies as far as like hydration with the water and Gatorade and things of that nature, and I would take her in. They usually ask for at least 24 hours if a child is experiencing a fever of 101 to bring them in. So I usually would bring her in then. And then also if she's having some excruciating pain to the point that the Tylenol or ibuprofen or just the hydrocodone that's at home is not doing it for her, I'll bring her in. If she has had like some type of infection as far as like just a simple cold that normally runs for like 2 weeks, I would probably let her experience it, the symptoms for about a week, trying to be more proactive, take her in to get fluids, hydration through IVs to flush out her system and pretty much help her body fight off the infection.
So, as a healthcare provider yourself, you're used to people being under your care. Is it difficult? We kind of touched on this a little bit earlier, but is it difficult for you to turn Miriam's care over to somebody else? And if so, why? And if not, why not?
Well, it is to a certain extent because they are the experts with pediatrics. I usually work with geriatrics, individuals 18 and over, and with children. I really don't have too much experience except for dealing with my own and close family and friends. However, I will have a tendency to just kind of sit back. I won't tell the individuals that I am a nurse until it gets to a point that if they're trying to get a stick or IV started or something like that and it's really killing her, they've stuck her more than 3 or 4 times and she start tearing up, which she's pretty good about the sticks actually, but whenever she raises her hand up and she looks at me with those big puppy dog brown eyes of hers, I have to get up and say, well, hey, this will be a better, place to get the IV, and this has worked before, so on and so forth. And so once I get to talking, then that kind of like brings up a little bell and say, well, hey, are you in the medical field or something?
Okay, so you don't put that out front, huh?
No, I do not.
Okay, why not?
I like to see basically, if she's going to get treated just like any other individual.
Okay.
Just to see how they react, and usually it is a different reaction once they find out that I am a nurse and I know exactly what's going on and how to do things. But no, I just pretty much just let them do their thing and let them take care of her as best as possible. And I'm watching. And I'm observing, as well as anyone else should. Is if I was taking care of someone else's individual patient, I want them to do the same thing. And then, if I need to, then I'll step in.
Okay. Has there ever been any situation where maybe they were ready to let her go, release her, and you didn't think she was ready? Because we've talked about that on the show a few times too, where people get dismissed a little early.
Not exactly. There was a time period I had transferred her doctor to the Indiana thrombosis from Riley Children's Hospital, and of course you have to change the hospital as well. And the hospital at St. Vincent's Children's Hospital was not quite prepared or knowledgeable about the sickle cell disease, and they were wanting to run just basic labs and tests before they started the actual procedures of hydration and also a antibiotic to help her fight the infection that she had. And they were basically stating that before they can give her any antibiotic or hydration infusion, that they had to find out what type of infection that she had. And so that's when I came out with my Sickle Cell 101.
Okay.
And so the emergency room doctor didn't know, and I didn't say anything to him about it, but I called over to the Indiana thrombosis and spoke to her then doctor, hematologist, Dr. Heine, and he was basically on call that night. And so he was able to come over and initiate orders with the emergency room doctor to go ahead and start the preparedness of the infusion, IV infusion, and the antibiotics for Miriam.
Okay. So let's change directions again a little. The sickle cell is very demanding on the patients, and it's also very demanding on the parents. Do you receive any support from family members or others to help you take care of Miriam?
I have a couple individuals that helped me with her, and one is my oldest daughter, Rashima. She's busy a lot, but whenever she can, she would try to help me with her. She kind of have taken over Miriam. It's kind of like a little mother to her, but whatever she can, she usually helps. And then also, I do have a boyfriend, a male friend, significant other that helps a lot with her whenever she's sick. Pretty much try to take over and take care of my other son and take care of her if need be, as far as making sure that she is being taken care of as far as with her hydration and her medicines and so on and so forth. Also as being a confidant, because you can get a little depressed or overwhelmed, and just pretty much just talking things over and trying to get a solution to the problem or problems, because then there's you may have to miss work and so on and so forth, and he's been able to juggle his schedule around a lot of times, so I can go to work, and then when I come home, then he'll go and leave and so on and so forth. So thank God that we have that flexibility that we can do that whenever she gets sick, and juggle around our schedules.
Are you able to get some time for yourself sometimes?
That's one of the things that I have initiated, and that is to get some me time.
Right. You need some me time.
Get some me time, and I'm fortunate that I have an older son as well that's 15, and he is very well educated on Miriam, and he watches her a lot as well. If I need to get out and do something for myself.
Yeah.
And it is really, really, really important to work on your mental at that time period and get freshened back up and stronger, so you can deal with all of the stresses of life, because we all know that the stresses of life could really bog you down at times, and if you don't have positive individuals in your life that you can talk to and get assistance and so on and so forth, it can go downhill pretty quickly.
During the break, we were talking about transitioning and how important that is. And, Miriam, she's still a little ways away from that. Most of the experts these days say you should start transitioning when you're about 12 or 13. So she's maybe, 5 years, 6 years away from that. So are you starting to think about that process, because you know how important it is?
I think about it all the time, and that's the reason why I advocate as much as I do, because I can't fathom to think that my child would have to endure the endurable as other sickle cell patients going through that transition. So I try to do whatever I can do now and to try to make changes, so whenever she reaches that threshold, she will be able to transition a little easier than most that have, paved the way for her. So,
okay.
Yeah.
All right. Thank you. Ladies and gentlemen, the Sickle Cell Action Network show is sponsored by Mass Therapeutics, a publicly traded biopharmaceutical company headquartered in San Diego, California. Mast is currently leveraging the molecular adhesion and sealant technology platform derived from over 2 decades of clinical, non-clinical, and manufacturing experience with purified and non-purified poleximers. Mast has developed a drug called MST-188 as a candidate for serious or life-threatening diseases with significant unmet needs. Among those needs is the treatment of sickle cell disease. Mast has enrolled sickle cell patients in a clinical trial known as EPIC. EPIC stands for Evaluation of Purified Polaximer in Crisis. If successful, EPIC could result in the first treatment of its kind to treat sickle cell disease patients while they are in crisis. The EPIC study aims to determine whether MST-188 can shorten the duration of a painful crisis. MST-188 is an investigational drug that has not been approved for commercial sale in any jurisdiction for any use. MST-188 potentially improves oxygen delivery, and it may help keep blood vessels from becoming blocked and more obstructed. It may improve blood flow by stopping cells from grouping together. It may also reduce inflammation, and it may restore cell membranes and give damaged cells time to heal. EPIC participants continue to receive their normal pain treatments during crisis, and their participation is free of charge to them. The patients involved in the EPIC study may not only be helping themselves, but they may also be helping future generations of those yet to be born. If you're interested in learning more about the EPIC study, please visit www.theepicstudy.com. We're going to take a brief break, and when we come back, we'll continue our discussion with Mary Moore. This is the Sickle Cell Action Network on RadioNext.tv, the Cool Groove site. Welcome back to the Sickle Cell Action Network. This is Gary A. Gibson, your host, and Sickle Cell Action Network is brought to you by Martin Center Sickle Cell Initiative here in Indianapolis, Indiana. We are a not-for-profit organization that has been providing services to people with sickle cell disease for over 45 years. Among the things that we do is we offer supportive services, including a support group, a food pantry, transportation assistance to help people get back and forth to their medical appointments. We also have an emergency financial assistance program, as well as helping people with general referrals. We also educate by participating in health fairs and doing presentations at schools and businesses and community groups. And we do a lot of advocacy. And that is what the Sickle Cell Action Network is about. It is about providing education, and it is also about advocating. We are happy to announce that on April 22nd, we will hold the 2016 Indiana Sickle Cell Conference here in Indianapolis, and that conference will provide presentations from noted medical professionals around the country as well as here locally. And we will also have an entire afternoon dedicated to presentations that are going to be beneficial to patients and their families. That is April 22nd here in Indianapolis, Indiana. Also, we're happy that on April 21st in the afternoon at 1:30, we will be hosting a town hall meeting on sickle cell disease featuring the Centers for Disease Control. The director of the Division of Blood Disorders will be here, and he will actively participate in our town hall meeting, and he will listen to testimony from sickle cell patients and providers. So we are doing these kinds of things to try to make an impact on sickle cell disease, and the Sickle Cell Action Network show is just one part of what we do to try to make life better for people with sickle cell disease. With me is Mary Moore, a registered nurse and mother of a child with sickle cell disease. We're having a great conversation. She's providing great information. I'm going to continue the discussion as we get closer to the time to wrap up, but I wanted to ask Mary a few more things. And Mary, one of the things I wanted to ask you, first let me start with a statement that I'm delighted that you're going to be conducting an educational session for sickle cell patients at our 2016 Indiana Sickle Cell Conference on April 22nd. Thank you for agreeing to do that. And also, in this session, you're going to talk about advocating for yourself in the hospital. So, if you don't mind, would you please share some of the tips that you're going to share during your presentation?
Yes, Gary. Some of the tips that I mentioned, or will mention in the presentation, is basically when an individual goes to the hospital, make sure you have someone there with you. And
great advice.
I know at times the sickle cell complications can hit you at any time, and some individuals do not have anyone to go with them to the hospital, but see if they can meet you out there or just be available if needed. And if you find yourself by yourself, try to remember to have a folder And with that folder will entail or include your medication list, your diagnosis, your lab results within, within the last 3 to 6 months. Basically a care plan of what will work for you in previous hospital stays and doctor's visits. That care plan will basically let the individuals know in the hospital know how to take care of you. A lot of time is spent in running labs and things of that nature, and that time can be cut if you know this information up front. Also have your doctor's information with you, your primary care doctor, and also your hematologist or whatever else you may have. Some individuals have more than one doctor, more than one diagnosis, and what pain medication will work for you best. What has worked for you in the previous past, as far as infusions, what type of hydration infusions that will work for you. What's the protocol? When you go into the hospital, you need to know your protocol, what they need to start on you first, when they're running the labs and so on and so forth, and make you comfortable while they're waiting on the diagnostic test and everything like that to come back. And you need to be comfortable. If they're not listening to you, have that phone available that you can call someone or your doctor, if they're available, or the nurse, to get them on the phone and say, hey, this is what needs to be done, so on and so forth. I've talked to other individuals that have had some horrendous experiences in the emergency room, and I do believe that if an individual have some type of medical knowledge and information about themselves, things can be a whole lot differently. The outcome can be a whole lot better. So instead of individuals looking at you as being like a narcotic seeker or someone that's just there just to take up time, they will automatically know because, hey, you have this information right on hand for them.
Very, very, very good advice. I'm really looking forward to your presentation in another month. Actually, a month from today.
Yes.
April 22nd.
Coming up quick.
Yeah, it is. So, Mary, this is maybe difficult too, but among other things, sickle cell is responsible for financial burdens on patients and their families. I've spoken to many patients who have thousands and thousands of dollars of medical debt. Is that true for you?
Actually, no. I was fortunate to have a career that, I could pretty much withstand a lot of things. However, it wasn't the same when I first had Miriam back 3 to 4 years ago. Well, 6 years ago when I first had her. For the first few years, I went through a really, really, really bad financial burden. I almost lost my house, my car. I almost lost everything that I worked so hard for because of the impact of having to take care of a child that was ill and I could not work. So with that demand, I can understand financially individuals not only just suffering from sickle cell but other illnesses. The impact that it could cause on a family is really, really, really horrendous. I've been blessed for the last couple of years. Miriam has not had, have to be hospitalized, and I'm able to work to provide for my family to a point that we don't have to look into losing everything in order to better take care of her. And also with the insurance, she has special health insurance, and that has provided a lot. Also the hospitals, if there's anything that's lagging behind, they also have like grants and scholarships that could help families that have children that are hospitalized and have the financial burden, so they will have a tendency to pay off the lagging bills or balances.
Okay. So did you at some point then have problems with some of your employers that just didn't understand?
Yes, the job that I was at before, they pretty much let me go.
Okay.
So
and this is a story we hear a lot too.
Yeah, and they didn't say that was the problem, but as soon as I got my RN degree, which I went through the RN program with Miriam being as sick as she was, so it wasn't nothing but God that really helped me get through that to be able to obtain the RN degree as I was going through financial hardship and sickness and all of the above with Miriam being sick.
Mary, in your mind, what are the 3 things that bother you the most about sickle cell, and why?
One of the things is the unfairness, the uncertainty, and also just financial and emotional bearingness on the individual and the families.
Mm-hmm.
And the reason why is basically, the individual do not or has not asked to have this disease.
They didn't do anything.
They didn't do anything. They
Right.
were just born.
Right.
And so, unfortunately, we have been seeing a lot of deaths associated with the complication of sickle cell in the sickle cell community. And these individuals just want to live a normal life.
And sickle cell can be very draining on families, not only financially, but especially emotionally.
Mm-hmm.
What do you do to help you keep things from getting to be too overwhelming?
Well, one thing, I keep the faith, and I'm also involved in church.
Okay.
I have some really good, a couple or a few support systems that are very positive that I can call and kind of let my hair down and just kind of vent a little bit, and just being honest with myself. I had a long time and to come to this point, and that is to basically just let individuals know that, hey, I need some help.
Right. Don't be shy about it, right?
Yeah.
Tell people, don't be shy.
So it took a while for me to come to that conclusion, and a lot of individuals wear a mask that you can't see the pain and anguish that they go through. But I've just learned to just let it go, and and just speak about how I'm feeling and so on and so forth, and also just taking time out for myself, and taking family vacations, and making history, because each and every day is not promised to any one of us, so
Right.
we have to make the best of each and every day.
Mary, my hat's off to you. You are, I think, an incredible individual. You are a dedicated caregiver. You're a dedicated parent. And you are a role model. And I appreciate the fact that you took your time today to be on the show with us. Thank you so much. I'm going to ask you before we close out the show, do you have anything additional that you'd like to share with our audience before we sign off? Any other tips?
Yes, I probably want to just leave with the thought of the families that are affected by the sickle cell disease, or any other disease for that matter, whether it be hemophilia, cancer, or whatever. Individuals that know the families, try to be supportive, try to be there for the individuals. Don't allow them to ask you for anything. Just try to be there for them, and just be supportive in any way it may be. It don't have to be monetary wise. It can be, as far as just saying that, hey, I'm a listening ear, you want to talk or whatever. Can I do something for you or whatever? We live in a society now that is your problem and your fault. That's your business, so you take care of it the best way you can. And we need to kind of transition from that and start being that village, because it takes a village to raise a child, and it takes a village to endure the endurable and to conquer the unconquerable. So even before Miriam was born with this disease, I've always been that individual to help others out, whether it was financially, emotionally, or verbally, whatever it may have been. And even though I've sowed my seeds, and I have definitely reaped my harvest as well, not from the individuals that I sold into, but other individuals out there that have seen the complications of what I was going through and was able to help out. So we need more individuals to step up and be that confidant, that person that's going to make a difference.
Thank you, Mary, and thank you again for being on the show, but most importantly, thank you for being a source of information and a source of inspiration too, I think. Hopefully those listening got a chance to hear something that was hopeful to them or helpful to them, and definitely we appreciate you not only being on the show, but you being on our team and helping us out with the advocacy that you do. It is time to close out the show, and as always, I start with a closing quote and then a few remarks. So today's quote is, "Life consists not in holding good cards, but in playing those you hold well." And this is a quote from Josh Billings, Josh Billings was actually the pen name of a 19th century American humorist, whose real name was Henry Wheeler Shaw. And he lived from 1818 to 1885. He was a famous humor writer and lecturer in the United States, and perhaps in notoriety he was second only to Mark Twain during the latter half of the 19th century. Sometimes life seems like a card game in which someone else is the dealer. And even though we may wonder about it sometimes, the reality is that the dealer isn't cheating us. He or she is just dealing the cards in the deck. Where we sit at the card table has as much to do with the cards we are dealt as those of the next person. Some of us get aces and some of us get twos. Some of us get pairs and others get three of a kind. Interestingly enough, the same hand that we are dealt could be either a winner or a loser, depending on which game we are playing. I spend a lot of time interacting with people who have sickle cell disease. And even though each of them seems to have been dealt a less than desirable hand, none of them are holding exactly the same cards. Some of this may depend on where they were sitting when the cards were handed out. Were they born into a family that had two employed parents, or were they born into a single-parent household? Were they born in a country with optimum health care, or were they born in a region of the world where the nearest doctor was over 100 miles away? Were they born in a time when sickle cell was a word that was whispered in hushed tones, or were they born recently, when there exists more hope for sickle cell than ever before? The answer to these questions can determine where that person is sitting at our imaginary card table, and consequently may dictate the cards that appear in their hand. I am a strong believer in keeping things relative. When we keep things relative, we start to see that it isn't really the cards that are in our hands that are important. It's the way that we play those cards that will determine the outcome of the game. Take poker, for instance. It is possible for the person holding a bad hand to beat the person holding 4 aces. It all depends on how well the person with the bad cards can outbluff the person with the 4 aces. In this scenario, life is the dealer, and sickle cell is the opponent sitting across from us. Yes, sickle cell, is holding 4 aces, but we have the option of playing his bluff every time. He doesn't know that he is no match for our inner strength, and he doesn't know that our patience is one of our greatest attributes. When he raises us one, and then we raise him two, he starts to wonder what cards we are holding. Could we be holding a royal flush, he wonders? In other words, we have the ability to control the outcome of the game just by how we play it. I mentioned keeping things relative. If we are able to do this, we can greatly increase our ability to outplay sickle cell. Let me tell you what I mean. The other day, I saw a man in a wheelchair coming out of a Dollar General store. He was being wheeled out by a caregiver. I immediately noticed that he didn't have any feet. He was wearing pajama pants, and they were tied off at his ankles. I felt so bad for him. And then I wondered, if I had a choice, would I rather have feet that could experience the pain of sickle cell, or would I rather have no feet in which I could not feel sickle cell's pain? That gentleman was dealt another hand of cards, and from the look on his face, he was playing them pretty well. This leads me to say, perhaps it is better to think about how we are going to play our cards than it is to focus on the cards that we have in our hands. It's just something to think about. That's our show for today. Join us again next week, same time, same station.